Audio check, testing 1, 2, 3. Audio check, testing 1, 2, 3.
Good morning, everyone. I'm Deidre Henderson, the Lieutenant Governor. Welcome to our press conference. Appreciate you participating. I just have a few words to say, and then I will introduce who everybody is waiting to hear from. And this is my first week of attending Unified Command meetings, and I've been really impressed with the professionalism and the sincerity and the hard work of everybody who's participating, who are working day in and day out to make sure that the people of the state of Utah are safe and that they have the resources that they need. My role moving forward is going to be to support Governor Cox in his objectives, to make sure that they're met in every way possible to be his support, and to make sure that all of our vaccine doses are administered each week. To that end, Governor Cox has asked me to visit sites throughout the state of Utah in the next couple of weeks to see how vaccine administration is going, to see what state resources are needed, to remove barriers and make sure that there is a smooth administration process of vaccines. And thank you to our media partners for your efforts to help people understand this pandemic and how the public can stay safe. There's some unsung heroes that I want to acknowledge this morning. We need to recognize. Even though we make so much information available on the coronavirus website, sometimes there's just no substitute for a human voice. Early in the pandemic, we worked with the Utah Poison Control Center to establish a hotline. That hotline is available 24/7 to answer your questions about COVID-19. Yesterday, the hotline hit an important milestone. They received their 200,000th call. Just to be clear, now they've received 205,341 calls. And since March 2020, the hotline has received an average of 655 calls every single day. A team of trained, caring operators answer questions on everything you can think of, from how long you should quarantine to finding a testing location, and questions about vaccine safety, effectiveness, and who can get vaccinated right now. The hotline is also able to help our healthcare providers with questions and do patient follow-up if it's needed for vaccine side effects. This hotline is also available to help callers in more than 100 languages. So we want to give our sincere thanks to the Utah Poison Control Center for their assistance. Now, we're going to hear from Governor Cox, who will be followed by Dr. Angela Dunn, our state epidemiologist.
Ladies and gentlemen, thank you for joining us today. We are excited to spend some time with you talking about vaccine distribution. I haven't had an opportunity in this new office and in this new setting to wish all of you a very happy new year. And it is indeed going to be a bright and happy new year because of these incredible vaccines that are coming. Now, I've made it no secret that I have been disappointed that we have not been able to meet the very high expectations for vaccine distribution. It is no secret that every state and just about every country in the world is behind in their distribution of these life-saving drugs. The numbers, you've seen them. Today we'll be reporting about 77,228 vaccinations. We believe, because of some reporting disparities, that actual number is closer to 90,000, but still far below where we should be at this point. Now, over the past few days, I've been meeting with our vaccination providers. I've been meeting with our staff at the state health department, with our local health departments. And this morning, I brought all of them together and gave them a very urgent message. There is nothing more important in any of our careers collectively than what we are doing right now. This is what the world has been waiting for. This is what we will be judged by. Our ability to get these life-saving and career-saving, economy-saving, health-saving drugs out to the people who need them the most. This virus does not sleep. This virus does not take weekends off, and neither should we. It is unacceptable to have vaccines sitting on the shelf. And moving forward, I assure you, there will be no vaccines sitting on a shelf. And so today, I will be issuing an executive order focusing on vaccine distribution. I have several announcements that I will make now related to that order. First of all, I want to talk about our long-term care facilities. This is where our most vulnerable live. About 40% of the deaths in our state have come from our long-term care facilities. This has to be a focus. Now, as you know, there is a federal contract with pharmacy partners that are distributing the vaccine in these areas. We have met with all of those partners today, and we have received assurances from them that they will continue to expedite delivery of vaccines in those areas, and they have. They've made some changes over the last couple weeks. They've ramped up. We're really proud of what they're doing. Our pharmacy partners, by the end of today, they will have vaccinated 153 out of the 353 long-term care facilities in the state of Utah, with about 9,000 vaccines administered. They will complete all of these facilities by January 23rd. Next, reporting discrepancies. Every facility will report at 7 a.m. every morning the doses administered in the past 24 hours. Vaccines will be distributed within the week they are received. Organizations that fail to meet that goal will have their allocations reduced, and extra doses will be taken and redistributed. Next, now this is not new, this has been there, but it has not been well publicized. If you have had a positive COVID-19 test in the past 90 days, you should not receive a vaccine. Now, I believe that number should be 6 months, and we will be working with the CDC to change that recommendation. We have to be much more practical about our application of this virus. While we don't know how long immunity to the virus lasts after receiving it, we have enough data to show that reinfection is very, very, very rare. If we want to achieve herd immunity, we shouldn't waste vaccines on people who have had the virus already and absolutely have some very strong immunity, we know, over at least the first 90 days. And so we want to make it clear in all of our publications to people who are signing up to get the vaccine that they should not get the vaccine if they have had the virus in the past 90 days. We should use that vaccine for people who have not had the virus and do not have any immunity. Now, this is another important change. Moving forward, vaccine distribution will be managed by our local health districts. This is important for several reasons. As you all know, we have 13 local health districts across the state. The most important reason is that they have the ability to vaccinate a minimum of 50,000 people per week with a capacity of up to 100,000 people per week. Now, our current allocation of vaccine from the federal government is only 33,000 doses per week. So by running this through our local health departments, we will be able to exceed with capacity the number of doses we are actually receiving. We are putting a tremendous amount of faith in them. They have come through. Over the past week, we have seen them really increase the doses that they are able to distribute every day, and we feel very confident that they will easily be able to meet that 50,000 per week threshold. The other reason that this is important is to simplify the understanding of those of us who are going to be getting the vaccine to know where to get that vaccination. By doing it by health district, we then base everything on geography. So we don't have multiple providers, we don't have people signing up in 5 different areas to get the vaccine, which will only clog up the system and make it more difficult to know where and who should be getting it and when they should be getting it. And so every local health department, again, based on your geography, that's where you will go to sign up to get the vaccine. If you live in Salt Lake County, you go to the Salt Lake County Health Department's website, and there will be information there. If you live in Central Utah, you go to one of the 6 county areas, you go to the Central Utah Health Department to find out where the vaccine will be offered, to sign up and find out when you will be eligible to receive your vaccination. We will also be focusing on vaccination sites in our minority communities. We must take extra caution not to make the same mistakes we made early in the pandemic without having testing sites available in those areas. We don't change the eligibility criteria for those in minority communities, but as new eligibility criteria opens, we want to make sure that we have vaccination sites available in the places where people live. Now, I'm very pleased to announce that starting on Monday, January 11th, our 50,000 Utah teachers and in-person staff will be eligible to receive the vaccine. We are encouraging districts to prioritize those teachers and frontline staff by age and comorbidities to make sure that during the next week, those that are again over the age of 65, those that have underlying health conditions, get the vaccines first before a healthy 25-year-old. So we're encouraging teachers, we're encouraging districts to make sure and get the vaccines, prioritize those that are most vulnerable first. Again, that will start next week. We will vaccinate as many teachers as we possibly can during that week. And then, starting 1 week later, on January 18th, every Utahn age 70 or older will be eligible to receive the vaccine. This is a very large population, about 240,000 Utahns, and we recognize that it will take several weeks to get all of them vaccinated. We have to choose between 2 different problems. One problem being very narrow groups of people that are eligible, showing up when they can, and having vaccines sitting on a shelf, versus having too much demand and not enough vaccine. This is not a difficult choice, it's an easy choice. We will always choose the latter. You will need to schedule with your local health department. Scheduling will begin next week. Now, we expect every local health department will run out of vaccine every week, which means, again, that it will take several weeks to get this entire population vaccinated. By the end of February, every person in this category that wants a vaccine should have one. Now, that includes our teachers as well. Again, we will vaccinate as many teachers as we can over the next week, and then local health districts will set aside some of that vaccine to make sure we're vaccinating teachers and our population 70 years old and older. Following that, we will then move to age 65 and some underlying health conditions that will be announced later. Now, I want to make another announcement. We've talked a lot about vaccines. We have another tool in our toolkit that is almost as effective as vaccines, and those are monoclonal antibodies. Now, we don't have many of them, and this drug is very special and important. You've heard a little bit about this. Of course, when the president tested positive for COVID, he received the monoclonal antibodies. They are extremely effective in preventing serious illness. But there's a catch. There's 2 catches, actually. One is that they have to be administered via an infusion, which makes it very difficult because there are few infusion sites, and most of them are located at hospitals. The other catch is that these drugs are not effective after someone has become ill enough to be hospitalized. And so we're in this catch-22 that the drugs that need to be administered to those to prevent them from getting sick are located in the places where people only go when they get very sick. We have to change that. We have received over 5,000 of these treatments from the federal government. To use this resource more effectively, as of today, I have asked our Department of Health, and we'll be ordering that we make some changes there. We are going to focus all of those doses specifically on our long-term care facilities with a combination of fixed sites and mobile infusion teams that will immediately head to a long-term care facility whenever an outbreak occurs. So again, in a practical standpoint, anytime we have an outbreak in our long-term care facilities, which again, where approximately 40% of our deaths occur, our mobile infusion teams will go directly to that long-term care facility, distribute the drug via infusion to those that have immediately tested positive. This will do more to prevent hospitalizations and to prevent death than anything else we could do short of the vaccine and the second dose of the vaccine. Now, these are changes we're very excited about, ladies and gentlemen. They are changes that will save lives. These are changes that will get us back to normal sooner. These are changes that will simplify the process and make it easier for all Utahns to know when they can get the vaccine, where they can get the vaccine, and to make sure that they are getting the vaccine and vaccines are not sitting on the shelf. We're excited about this new year. We're excited about the opportunities that lie ahead. Unfortunately, this disease is surging again. We are seeing a post-holiday surge. We have to do more. The fundamentals still apply, my fellow Utahns. Wear a mask, physically distancing, testing, contact tracing. All of those things are still important for us to arrest the spread of this virus until we have vaccines distributed to everyone in the state. Now, thank you for all that you're doing. I want to thank our incredible vaccine partners. They have recognized when we've made mistakes. They've made important changes, and we're so optimistic moving forward. Now, it's my pleasure to introduce to the podium Dr. Dunn.
Good morning. Today, our 7-day rolling average of new cases is 3,051 per day. This is a big increase from last week when we were at 2,371. And our 7-day rolling percent positivity is at 32.7%. Last week, we were at 26.8%. Overnight, we are increasing our cases by 3,793. And our referral ICUs are at 92.2% utilization. Effectively, our ICUs across the state are full. And this is the spike, as Governor Cox just said, this is the spike from our winter holidays. And we're continuing to be in a very high-risk situation for spread. It's clear we've let our guard down, and there is a lot of excitement about the vaccine, but we need to come together again. We need to focus on what we can do as individuals to protect our hospitals by preventing the spread of COVID. And again, those fundamentals apply. Wear a mask, physical distance as much as you can, stay home when you're sick, get tested. If you feel sick at all or have been a close contact, we have plenty of testing capacity, and we need to identify who is infected with COVID. We still need to isolate and quarantine when we're infected with COVID or we're a close contact to somebody who's a confirmed case. And especially when it's your turn, get vaccinated. We can do this. We've done it before. Right before Thanksgiving, we came together, we adhered to public health guidelines, and we avoided that expected Thanksgiving surge, and we need to do it again now. Thank you.
Okay, ladies and gentlemen, we're happy to answer any questions that you might have about today's announcements.
Hi, Paul Nelson of KSL News Radio. Joe Biden has said that he would release all of the vaccines instead of holding on to them for right now. Is the state equipped to handle that influx of doses, and would that not, say, cause a log jam, or are the state facilities ready to go to handle that, say, increased amount of vaccines?
Yeah, thank you, Paul. We heard that news this morning. There was breaking news about that decision from the incoming administration. We are prepared and will be ready when and if that actually occurs. Of course, what they're talking about there is releasing the second doses as well. We can store those here in the state, but we are working. Our long-term care facilities are working with our partners and others at additional high throughput sites, so that we can distribute as much vaccine as they will give us. And furthermore, we believe that by making these changes and being able to exhaust our supply of vaccine, that will make us eligible for more vaccine down the road. It's hard to argue that we should be getting more when we're not using the vaccine that we have already received. And so the answer is yes, we will be ready, we will be prepared for that. There is a national discussion happening right now about the possibility of delaying second doses. We will not do that as a state until there is a consensus. We know that the UK is doing that as well. There is some evidence, and we've had several very high-profile medical professionals that are arguing for delaying the second dose to get as much of the first dose out as we can, and get closer to immunity with a larger percentage of the population. Of course, having those doses available in the state, if that decision were to change, then we would be ready and prepared to increase those first doses. But as for right now, we would use those second doses. In fact, we are already started with our second doses with our hospitals and their staff, and so they this week they are starting to deliver those second doses, and we anticipate that will continue.
Hello, good morning. This is Sebastian from Univision. This question is going to be for Governor Cox. I'm going to make the question in Spanish. If Governor Cox would answer me in Spanish as well, would be great. Gobernador, ¿para cuándo calcula que estaría listo, según el plan de vacunación, cuándo podríamos todos, el 100% de la población de Utah, recibir una vacuna? ¿Y cuál es su mensaje para la comunidad hispana ahora que tenemos esta esperanza de que la vacuna está cerca? La comunidad hispana, una de las más afectadas en el estado.
Bueno, gracias, Sebastián. Esperamos tener la vacuna por toda la población de nuestro estado por el abril o mayo en este tiempo. Depende en las vacunas diferentes que podemos recibir. Ahorita tenemos 2 vacunas diferentes. Esperamos en marzo tener 2 más y muchas más vacunas aquí para toda la población. Esperamos por la primavera y entrando en verano. Y el mensaje que tengo para la población latina es la misma para todo el estado. Es que es un mensaje de gozo, de paciencia, pero es un mensaje de esperanza más que nada, que en los días y semanas y meses que vengan, que tendremos la oportunidad de recibir esas drogas tan poderosa que pueden cambiar nuestras vidas, que podemos guardar la vida y la salud de las personas, y también que nuestro trabajo y la economía pueden seguir adelante.
Hi, Governor Cox. This is Sophia Eppolito with the AP. I have a question for you about actually managing this disease right now. Obviously, we talked a lot about vaccination, but today we've seen a 7-day positivity rate of 32.7%, which, as you all know, is extremely high. And I'm curious, I know testing has been expanded, but is there an idea of how many people we need to be testing every day or every week to get a number like that under control and to get a sense of how bad the virus spread is? And I'm also curious if you're considering any additional restrictions, anything like that to limit the spread of COVID.
Thank you, Sophia. Dr. Dunn can obviously do better on the numbers, but I think the positivity rate is a good indicator of where we need to be. So somebody that's a little better at math can do that. But when we have a positivity rate of upwards of 30%, that's extremely problematic. We want to be below 10%, and so we need testing in order of magnitude greater than what we're seeing right now to ensure that we are catching all of the cases that are out there. And the reason that that's so important, again, if we can catch those cases, people can quarantine, we can prevent those from spreading, we can get that transmission rate under 1, which is where we were coming out of Thanksgiving and heading into the holidays. We know how to do this. There are no more secrets. Of course, we're seeing this surge all across the country. The hope is that now that we're out of the holidays, that those gatherings will be discontinued. We are testing at our universities within the first 10 days. That's where the first surge really started. We know was in the universities. Every student should be tested within the first 10 days of coming back to campus. We've expanded testing in our high schools. A great example of this at our high school and middle school. This week, they have opened up testing sites for everyone in the community. Anybody can come and get tested. And so we bought testing supplies, over 1 million new tests, so that we could be prepared for a moment like this. And so, as Dr. Dunn has said, we need everyone to get tested who has been in close contact with someone who has tested positive for the virus. Anyone who has any symptoms, again, the tests aren't as invasive as they used to be. So please go and get those tests, get your results, and that's how we're going to slow the spread of this virus. We don't have any immediate plans to make any additional changes to what we're doing. Again, it's on all of us, though, as individuals to make those sacrifices. And what's so frustrating is that we are so close. Again, knowing now that grandma and grandpa, anyone over the age of 70, over the next few weeks will be able to get their vaccine. Let's keep them alive during this time. We can do this. Just a few more months, and we'll be there. And my hope is that sense of optimism, knowing that the end is in sight, will encourage all of us to make the sacrifices necessary over the next few days. Last question.
Hi, Governor. It's Ben Winslow with Fox 13. With your announcement of speeding up the timeline to distribute the vaccine, particularly with long-term care facilities, educators, and now people age 75 plus, does this speed up when your expectation is the general public will get the vaccine?
Yeah, and Ben, let me just correct you, 70 plus, not 75 plus. So I just want to 70 and over. The answer is yes, we hope so, right? And so much of that will depend on the uptake by these groups. And what we're seeing is, especially in our senior population, there is a very, very high demand for this vaccine right now. And so yes, again, the more we use this, the quicker we use this, that moves all of our timelines up. And hopefully we will be the beneficiaries of receiving more vaccine from the federal government as we prove our ability to use it before the expiration date to get this off the shelf, and then as those new vaccines, as AstraZeneca and Johnson & Johnson potentially come online in March in those timeframes, and now we're getting hundreds of thousands of more doses, that we can move that timeline up for everyone in the state. But here's the thing, and I can't emphasize this enough, and really this is where we've made a mistake as a country. When you have such a limited amount of something that is so important and so powerful, connecting it to where it will have the most effect, the most positive effect, makes all the sense in the world, right? We shouldn't be giving a vaccine to someone, even if they work for a hospital, who works at home and isn't dealing with patients and they're 25 years old. That doesn't make any sense at all. It does if we have plenty of the vaccine. But right now, what we know about this virus is if you are over the age of 70, if you're in a long-term care facility, you are the most at risk. And so by doing this, we're going to bring down those death rates. Next up will be people over the age of 65 and people with those underlying comorbidities, because we know, again, we have enough data on this virus to know who is the most affected. And by being smarter and quicker about getting it to those affected populations, we get close to back to normal than we would if we were just randomly doing this or doing it based on industry or employment or some of those other categories that again may make sense on paper but don't make any sense in practicality. So this is a critical change. We're excited for this change. By the way, we have buy-in from all of our providers. Everyone agrees that this is the direction we need to go. I was able to speak with the President of the Senate, the Speaker of the House. They fully endorse this plan moving forward. It's good for Utah. It's good for the people of this state, and it's going to be good for all of us as we go forward. Thanks again to all of you for helping us get the word out. We will be signing that executive order very shortly in the next few minutes. We'll get a copy of that out to each of you, but we're off to a good start in January as a state, and we're looking forward to great things to come. Thank you so much.
All right, that concludes the briefing for today. We're expecting these briefings to resume on Thursdays moving forward. So we will talk to you again next week. Thank you.